How to treat the physical side effects of opioids. Opioid use disorder, or OUD, has been ravaging the United States since the late 90s. Recently, opioid overdose numbers have risen dramatically, and more people are seeking help. Though there are many ways people suffering from OUD can seek help, treatment may not stick. Some patients may have trouble coping with the physical side effects of opioids, no matter how far they are in their addiction. Suboxone treatment could help control the physical side effects of opioids. If you are experiencing any side effects from your current opioid medication and it seems to interfere with your daily activities, do not fret. This video will discuss how to manage these side effects. Suboxone is a medication-assisted treatment used to help cope with the adverse events that lead to opioid dependence or addiction. It helps those struggling with substance use disorder. Suboxone is an opioid medication that contains an opioid partial agonist which binds to the same receptors in the brain as opioids but does not create the same high sensation. It is a medication that effectively works when combined with therapy to reduce cravings and withdrawal symptoms. When you start using drugs, it feels almost euphoric. That is because opioids release a neurotransmitter called dopamine. Dopamine is associated with the reward center of the brain and gives you that sense of pleasure. Over time, however, your body adapts to the presence of opioids. The drug takes more to get the same effect or tolerance with continued use. The dangers of drug addiction, especially opiates, have been a national concern for many years. Physical side effects of opioids do not happen overnight. It is a gradual process that eats away at you and your body. Some side effects vary, but the most common side effects include the following: slow breathing, drowsiness, constipation, nausea, vomiting, loss of appetite, weakness, muscle aches, muscle cramps. Abusing prescription pain medications can result in various unpleasant symptoms, acute and severe pain, many of which are dose-related. These common side effects can pose a safety concern and vary from person to person. Opioid addiction can have several negative consequences, from physical appearance to opioid overdose. Withdrawal symptoms can be either mental or physical, but both types result from your body's reaction to not having the drug and your body's dependence due to cravings. Physical withdrawal symptoms are caused by changes in the way your body functions. These changes can be uncomfortable and sometimes severely painful and very dangerous. Mental withdrawal symptoms are caused by the sudden lack of dopamine fed through the body over time through these prescription or illegal drugs. The sudden absence of dopamine can cause one's mental health state to collapse entirely and lead the individual patient to become severely depressed. Overall, opioid withdrawal symptoms are a significant factor that prohibits people from seeking help and a major hindrance for those looking to recover from their addiction. In addition, the fear of going cold turkey keeps them locked into this terrible cycle of continuing to use. Opioid withdrawal can have many symptoms that may occur altogether or individually. These can include physical side effects from long-acting opioids. But what exactly are the symptoms when you are going through a withdrawal? For some, it can be nausea and vomiting, while for others may lead to hallucinations, sleeplessness, and cramps. Some may experience chills and mental confusion. It all depends on the person, from their long-term use of opioids and the kind of drug they are taking. The essential thing to remember is that everyone's experience is different, and there is no one right way to feel when going through withdrawal. It can be the most taxing process in your life, but treatments are available to help make it more bearable. With opioid use disorder, somebody going through opioid withdrawal from illicit drugs usually manifests several symptoms from the list above. A primary care doctor or a licensed Suboxone doctor will assess your medical history and drug use to determine the cause of your symptoms. They may also conduct a physical examination. Doing so can help them determine the underlying causes of addiction, like prior mental disorders or a family history of abuse. These synthetic opioids can be a significant safety concern for you and others. Diagnoses are not the same for everyone. With factors that can lead up from age to the lifespan of consumption of these opioid drugs, you must not self-medicate to avoid accidental overdose. One of the best and safest bets for treatment for opioid use is medication-assisted treatment. It is a dual diagnosis treatment that combines medication and behavioral therapies from mental health services. It helps take on the problem to ensure long-term prevention of the adverse effects of opioid use disorder. Suboxone treatment has a higher success rate and less addictive rate than most treatments, like methadone treatment, when dealing with the adverse effects of opioids. With Suboxone treatment, licensed healthcare providers administer behavioral health therapies that can help you achieve long-term sobriety. Opioid withdrawal can cause many complications depending on the individual's long-term use and addiction severity. It is also affected by their underlying health or medical conditions. It is essential to call your healthcare provider to seek professional help when considering quitting opioids so that any potential complications can be managed from the start. You must remember that the withdrawal stage can make or break any patient. The feeling of withdrawal has terrible side effects, including changes in blood pressure, chronic pain, shallow breathing, hot and cold sweats, and many others. Behavioral therapies can be introduced in treatment to further contain the mental effects of opioid withdrawal and future opioid overdose. In the long run, opioid withdrawal is a process that takes time, effort, and, most importantly, patience. Many treatments are available to help you, depending on what suits you the best. When done meticulously, the chances of getting clean are as easy as reaching out. With Suboxone treatment, healing starts from day one, beginning with an assessment by your Suboxone doctor. Your medication is combined with behavioral health therapy and other rehabilitation to manage your physical and mental side effects. Cravings from illicit opioids will come and go, but sticking to the game plan is crucial. Remember that this is a lifelong battle. With Suboxone treatment, recovery doesn't have to be as hard as it once was. It is challenging to cope with the physical side effects of opioids, especially when going through withdrawal. But with proper care and treatment, the better part of your future is always a step closer. The physical side effects of opioids are taxing, but treatments are available to get you through it. However, your commitment to your journey to sobriety is still crucial. Withdrawal and the mental effects that come with opioid addiction can lead you to feel even worse than where you left off. But with perseverance, you can eventually recover from your addiction. So if you want to take the first step to getting clean, get in touch with a Suboxone doctor near you. At Suboxonedoctor.com, we make it our mission to give those who seek help a chance at the first step toward their new future free from addiction. Our compassionate and capable environment can provide you with the best care possible. Seeking professional help is always a wise decision regarding opioid use, and we want to be there for you throughout your recovery journey. Visit Suboxonedoctor.com today to start your journey to sobriety.